All right. So with that, I'd like to introduce our researchers and myself. So hello, my name is Madeline Kruth. I am the research facilitator for health studies and for the Center for Critical Studies of Rural Mental Health. Welcome to our Health Studies and Center Rural Mental Health Seminar Series. Brandon University has campuses on both Treaty 1 and Treaty 2 territories. Our main campus is located in Brandon, Manitoba on Treaty 2 territory, but we also have presenters today in Winnipeg, so that's why we're acknowledging both of our treaty territories. It is traditional shared land between the Dakota and the Ojibwe. The Turtle Mountains and Brandon area were also home and are also home to the Métis people. Settlements along the Assiniboine River and into the northeastern areas of Saskatchewan created a chain of Métis communities. We at Brandon University acknowledge and respect the history, land, and people of this area. On behalf of Brandon University and the Center, I welcome you to the traditional homelands of the Dakota, Anishinaabe, Ojibwe, Cree, Dene, and Métis people. So as I noted just prior to turning on the recorder, we are recording this session and it will be up on the Center website. Once we get to the questions, I will discontinue the recording. Darlene will be managing the session. She will mute everyone's mics while the speakers are talking. So to ask a question, please unmute your mic or write it in the chat. I also like to keep track of who attends for our records. So if you could please put your name and affiliation in the chat, I would be very appreciative. The presenters will speak for about 30 to 45 minutes, followed by a question and answer period. So with that, I would like to introduce Kathryn Chachula from the Faculty of Nursing and Debra Dusome and Nadine Smith from the Faculty of Psychiatric Nursing for their presentation entitled New Graduates Transition to Practice.
Thank you very much for that introduction, Madeline, and for the land acknowledgement. As Madeline has mentioned, I'm here today with my two colleagues, Debra and Nadine. And so we're going to take you through our research findings that explored new graduates' transition to practice. And this research occurred during the pandemic from 2020 to 2021, with member checks conducted into the 2022 calendar year. And so this next slide I'm going to show will provide an overview of our complete research project, and then we'll be walking you through some of the more individual components. So as this slide alludes, this study used Sharma's grounded theory using arts elicitation methods to generate individual narratives and group discussion among the participants and the researchers to understand new graduates' transition from being a senior student to becoming a practicing professional. We know from Judy Boychuk-Dukeshire's transition shock theory that new registered nurses face many obstacles during their first year of practice, but very little has been published that explores the transition experience of psychiatric nursing students as they gain their registration as nurses. And so we set out to explore both RN and RPN transition by interviewing graduates from both the nursing and psychiatric nursing programs. And out of our 13 participants that we had 9 RPNs and 4 RNs participate. And we actually found very few differences between the two categories of graduates as they entered practice. And so there is room for further research here to explore other professional-based programs as they convocate their students into practice and enter the practice arena. So later in the presentation, Debra is going to present some recommendations that target the two classifications of nurses, both RNs and RPNs. And Nadine will also be able to provide you with a greater in-depth look at the data collection. But I will mention that when using the Sharma's grounded theory methodology, Sharma's really emphasizes the co-creation of knowledge between the researchers and participants. And so in many respects, the researchers created a space that allowed for the participants to identify the major themes that arose from the study, with facilitation by the researchers. And so the data collection involved both interviews and focus groups centered on those arts elicitations methods, and included use of sand tray objects or figurines, the creation of collages, journaling activities, and concept mapping to understand new graduates' transition. So art elicitation methods really allow us to understand the representation of concepts and the symbolism of objects and their meaning that truly fits the methodology of Charmat's grounded theory to inform theory development. And you can see in the center of this slide an overview of this conceptual diagram that involves new graduates' transition to practice. So as I mentioned, the three of us will be speaking today, and Nadine will be taking you into a deeper dive of the three phases of our research, and Debra will present an in-depth look at our theoretical model with recommendations for both university programs and employers. So at this point, I will hand over the speaking part of the presentation to Nadine.
Thank you, Kathryn. So here is an example of phase one. So during the interviews, we had a large table in the middle of the room, and it was full of different objects, hundreds of objects probably. And these are some of the objects that were on the table. So basically we had the participants come to the table one at a time and pick out different items that spoke to them. So we didn't want the participants to say, I don't know if why I need this, but if it called out to them, we just wanted them to grab that object. So objects were placed in front of the participant in a certain order. So the object in the front, so in this case, we have the two little teacups. So the object that was placed in the front was how they see themselves facing the world. Once people get to know them a little bit better, those items were placed at the side or behind. And then we have in the center, that would be your innermost being. So in this case, we have the dog figurine. So the innermost being basically being that part that you don't usually share unless you're close to people. So in the front, we have those two teacups showing basically how they face the world. And this is just one example of some of those objects that one of the participants grabbed. We'll change slides there, Kathryn, please. Okay, so here is an example of another one from phase one. So we also had participants do a collage, as Kathryn explained. So this collage here from one of our participants portrays your ideal registered, or in this case, it was registered psychiatric nurse, or it could have been a registered nurse. So participants used magazines, they used old calendars. We had lots of pictures that they could use to cut out pictures. And this is one of the collages that a participant came up with. So for example, one participant picked out pictures that represented serenity, emotional balance, and maturity to them, as well as inner peace and a sense of spirituality. They also chose some pictures that represented being industrious, being curious, and being a hands-on worker, which motivated their critical thinking. They also chose pictures of having fun and being silly. So having fun with friends and having a rich outside of life work. So this is one example of how the collages looked. Okay, we can switch it over. Okay, so this is another example of a group of objects from the participants. So again, these were more objects that were on that big table in the research room there. So we have a teapot and the tea. That was important to this participant because it was part of their culture, part of their family's culture that was passed down to them. We have a wall hanging in the back that has flowers, and it's hard to tell from this picture here, but the glass is cracked. So this participant was drawn to this item because of that cracked glass, actually. And one of the things that the participant had said was that it's perfectly pressed, but it's still imperfect. We have a butterfly that was chosen because they often see butterflies either in groups or all alone. So it's like they were able to go from different group settings to being very seclusive at times, which they also believed is a good quality. In this case, it was a psychiatric nurse. So being able to socialize, yet being able to work alone. In the middle is a rock or a seashell. Either way, they said it was rough and imperfect. And again, they said, in this case, they said imperfection is in all of us, but we are all perfectly imperfect. And then in the front there, they chose the green stone, which is smooth and perfect. And as they said, they present themselves to be, that's how they kind of present themselves to be, because in this case, they resonated with trauma, and people wouldn't know that unless they got to know them. So this is another example of the different objects. And we can switch. So now we are moving into phase 2. So because of the COVID pandemic, phase 2 was done virtually. So again, we had participants do a collage. And so because it was virtual, basically they were able to grab any image off of the internet. So this is just one example of one of the images. There was lots of images on a PowerPoint slide, and this is just one of the examples. So it's Elmo up in flames. This is one of the images that a participant chose. So we have Elmo here, and he's saying, "Let it burn." So the participant found this image. They thought it was funny. It was part of memes that they said that they liked, and they see a lot of nursing memes using this image. So this particular image resonated to this participant. And we'll switch to the next one. So again, in phase 2, this is another image that resonated to a participant. Again, this would have been on a slide with lots of different images, and we just gathered a couple just for some examples here. We have a baby pumping its fist. So this photo resonated to that participant. As they said, just do it, and to hell with overthinking it. And we can switch. In phase 2, we also had participants go look for objects around their home, since we're still doing it virtually. So participants took about 5 minutes or so to select 3 to 5 objects that were in their home. And again, it depicted their ideal workplace environment. And once they gathered them, the participants placed the items down and took a picture of them and emailed them into us. So this is one of the examples that we received from the participants. So here we have, we've got some headphones there on the left. And that was chosen because for that participant, it's nice to work in an environment where they felt like they were listened to, and staff felt more listened to in general. There's also a full glass of water and a pen on a scale. So they wanted to be listened to when it came to staffing. If so, they would have more of that feeling of a glass being full while maintaining their workload. The pen represented work, as well as that full glass represented not getting burned out. And the scale there for this participant was used to represent having the work and the feeling of the full glass and equaling balance. So this is one example of the different items that the participants used to kind of go around their house and depict their ideal workplace. And we can switch to the next one. So phase 3 was a little bit different here, as you can see. So in phase 3, we have some themes, and participants did a concept mapping activity. And in this case, they could use select themes that resonated with them and their transition to practice. So participants placed different themes on the ruler, and that ruler represents the months of their first year of practice. And then they explained why they chose particular themes and why it fit best on the certain timeline. So as you can see, as soon as they started off, importance of belonging was important to them. And it transitions all the way to towards month 11 to 12, where contributing to the work environment was important. So this was an example of a concept mapping activity. Then we can switch, Kathryn. So here again, we just have some additional examples of, we've got some collages. We have the objects, as you can see on the right side. And we have some more concept mapping activities. So again, all of these different examples provided rich insight into their transition to practice. And I will pass off to Debra.
All right, thank you very much, Nadine. And Debra will pass over the speaking baton to you.
Okay, so next slide. So I'll go in a little bit more in depth. So, and the thing that we found is obviously we had to change our method of gathering data, but also we obviously had to bring up the issue of COVID and how that impacted how people saw their transition. Although certainly some of these themes from earlier research without a pandemic, there were some similarities, but this group in particular was impacted by COVID. So in months 1 and 2, it's facing the unexpected and what it is like to come into a new workplace, and it's not exactly what their experience was like as students. So it was unexpected. They didn't know what to expect. And certainly part of the ambiguity was certainly in the workplace was from day to day, even the staff they were working with in terms of COVID guidelines, and things were constantly changing. So even a new person coming in and sort of saying, well, what is the routine? It would be, well, this is the routine for today, but tomorrow might be very different. There was a relearning in terms of new graduates constantly being told that real nursing or real psych nursing is not how you've experienced in school. And you have to get with the program because it's very different. So that kind of relearning around what was learned in school and what was the reality on the frontline ground. The important piece here for our graduates in month 1 and 2 was they wanted welcome and belonging. And some of our graduates experienced that, and some just experienced that they were thrown into it. Some of them didn't have orientations till like 8 months down the road. It was kind of with the pandemic. We don't have time for this. You need to hit the ground running. And so they had this sense of just being thrown in this. But in that, they recognized very quickly what their strengths and weaknesses were. And they found that staff members were quite willing to tell them what their weaknesses were and where they were not measuring up. And so, they saw things, the students experienced, again, not what they expected or things that they didn't like, or they would feel the sense of moral distress and perhaps not feeling welcome and belonging, but feeling at this point early in the transition that they couldn't speak up. So their perception of themselves as students might have been that I'm quite assertive and I can communicate my needs, but coming into this sort of unexpected environment, being new in the job, plus all the stress of the pandemic, they didn't feel that sense of being able to speak up in the same way. In months 3 and 4, they focused more on dealing a lot with the stressful situations, their own personal triggers. They felt very overwhelmed and burnt out. And they were finding ways to cope. And the greater percentage of our participants identified negative coping strategies, significant amount of substance use, talking about compassion fatigue, being burnt out, being totally astonished at how quickly that had happened. And this is the low point in their transition. And one of the interesting things is a lot of jobs have this like 3-month probation. And after 3 months is when the workplace starts expecting more, that you're not brand new, which in our transitioning graduates, this is their low point. But in this low point, they started doing some real reflective pieces and sort of saying, I'm using negative coping and I need to get in and utilize more coping strategies. So the fact that this group was here in terms of COVID, it's the things and the normal supports that they would have sought out were not there. So they couldn't go and visit their classmates and their friends, and some of them were isolated from families. So other than things like, FaceTime or phone calls, they didn't have those immediate supports. They also didn't have things like healthy social activities, like going to gyms and those kinds of things. So it was a low point for them. And some of the participants talked about, so different nursing people on their units would have group chats, and they had prior social relationships and connections, but the new people coming in didn't have these. So they were kind of outside of the group, whereas the group that was working in very stressful circumstances, they'd had these outside work relationships, they had history with each other that the new people didn't have. Round about month 5 and 6, they've recognized some of their negative coping. They want to focus on getting more work-life balance in their life. Pushing through, if you notice, one of the picture was a train and the toddler with the fist. A lot of it was like, I just have to push through, and kind of that story, I think I can. And it's like, I just have to day to day slug through this experience that is hard. This is also the time that they talked a lot about isms, criticism, racism, sexism. Criticism was interesting because it had both negative and positive connotations. So the negative connotations was the sense of, I'm being left to flounder here, so that they wouldn't get a lot of feedback around new experiences, but if they didn't do them perfectly, they were told that, well, that's not correct, that's not the way you do it. And many of them said, I would have appreciated more guidance around, you've never done this before, this is how you can do it, can you share some tips, and maybe I can watch you and then I can do it on my own. So there was, some people, depending on the unit culture, had those tips and tricks and supportive, and people saying you don't have to know it all at once. And then others, it seemed that they were left to flounder, and then people would criticize them. Pretty much all of the participants, and in particular our BIPOC graduates, talked about racism in the workplace and how painful that was, seeing staff members act in racist ways towards patients, and those in the BIPOC population experiencing microaggressions on a regular basis, and then not really knowing what to do with it. And part of the issue that they identified is, I really want to be welcomed and belonged, and so I don't want to make waves, especially because I'm really new. And if there was a real critical incident, where do I go and who do I talk to around these things? So all of these organizations tend to have respectful workplace policies, but if the new people have not had a really good orientation, they don't know where to go and what is the procedure and who to talk to, and felt pretty intimidated about that. And sometimes they talked about the fact that maybe the more welcoming staff member was also the person that was acting in very racist ways. So they had to decide, do I want to feel this connection to this person that's mentoring me, or do I want to stand up and advocate for myself or for patients? The other thing that did come up was sexism. Other staff members just feeling comfortable to touch people on their shoulders, on their hips, or being sent somewhere just because you were male and there's a cold white. So whether you've been trained or not, you're a male and you're going. So those kinds of things. The thing about criticism that was really interesting was they also saw, many of them saw it as a positive. They saw it as feedback that was going to challenge them and help them grow. As long as it kind of wasn't a steady diet done in a derogatory way, the participants felt that this kind of feedback, this critical feedback, was helping them grow. And so as they sort of came through this very overwhelmed period of time, in months 5 and 6, they started to create more balance in their own life. And it was usually through reflecting, looking at their own triggers, recognizing, okay, what's going on with me? Whereas in the beginning, it was like, I just have to get through the day. I just have to manage this. I don't have time for going internally and looking. So in months 7 and 8, it's starting to find meaning in the team environment, looking at being adaptable and flexible and getting validated and support. So just somebody just as simple as saying, you can do this, or you've got this, or someone commenting on a particular skill or something that they offer and they feel listened to. And so when they get that validation, then they feel good and they feel like they're growing and they're going in the right direction. In months 9 and 10, they're starting to have a sense of themselves, of their professional identity. They're having confidence in themselves and their skills and their knowledge. I do know something. I do have something to offer the field. They're finding that they're listened to more, that they can contribute their ideas, and they're accepted. And then months 11 and 12, the majority of our participants were developing that confidence in self. They felt that they were resilient, and that they were then in a place where they felt they could support and mentor and nurture new graduates. So if there was someone new coming behind them, they actively went to support that person. And I don't know whether you can see in the little picture, but there's 2 little saplings growing up here. So yeah, so that's kind of the trajectory over the year. And some people were a little bit earlier and some people a little bit later, but the bulk of the responses fell in these months here. And it was interesting that we were able to continue with the research, and people ran around and did things in their homes and created images. And some of them liked the in-person making collages, and some of them really liked the freedom of just being able to pick exactly what they wanted in terms of their communication. Next slide. So, all is not dismal. And the grads went through all the transcripts, and they talked about some really positive things. So many of them had welcoming and supportive colleagues that created a sense of belonging, the sense of being listened to and feeling heard. Mentoring relationships, and when more experienced nurses shared their knowledge. They liked the mix of experienced people and new graduates on the unit. So they did not like being the only new person. And so they wanted a balance of that peer support of not being the only one, but they really were open to learning from the more experienced nurses. Being given time to grow and learn. So statements like, you don't have to know it all at once. Our expectation is that you will be able to do, is not that you'll be able to do everything perfectly. That kind of the invitation, let us know if you've not done a particular thing before, and we can walk you through it and support it. Involvement in team activities, and this became really important because obviously teams were not going out and socializing and the kind of social events that teams sometimes do. But some of our participants talked about on-unit activities that they were doing to boost morale, like little contests or things that they were sharing, and being invited to participate in those things helped them to feel as part of a team. And then getting a work-life balance. This is something that took some time, usually around months 5, 6, and 7, was recognizing that things were really skewed in the beginning, that the stress of learning and confronting the stressful situations basically had people doing their shifts and coming home and sleeping, or coming home and making a meal, playing Lego with their kid, and watching sort of mindless TV, not a whole lot in their world, to moving to, a work-life balance and creating healthier meals and doing physical fitness at home and getting outside and going for walks, the things that they could do. So those were the things that they identified as positive. So recommendations for universities and nursing programs. Overall, they basically felt that the senior practicum placement, or the 4th year placement, should be 12 weeks. And this particular group was the last group that had in psych nursing an 8-week practicum. So they were really happy to hear that the students the year after were going to have a 12-week placement, because they sort of felt like at 8 weeks they were just starting to get it, and it would have been nice to have those extra 4 weeks to solidify their skills. They like the idea of having practicum placements on places that are actually looking to hire people. And some of them that had the more positive experience in transitioning ended up being hired on units where they had done their senior practicum. So they sort of felt like they already knew some of the routines, and so it wasn't as steep of a learning curve. More structured 3rd and 4th year practicums with assigned preceptors. So we've had challenges in the universities, and sometimes have not been able to have individual preceptors for students. And we've had group placements where a supporting faculty might travel throughout the facility and address several students, where students are kind of left on a unit and they're not even paired with a particular nurse. They're not even told that you're going to be with this nurse today. And so they found that not as beneficial, and people were envious of senior practicum students that had an actual assigned preceptor or mentor. So the psychiatric nursing really felt that they wanted more refreshers on their medical nursing skills, and actually several of them commented, I mean, you always told us through the program that we had to have these skills, but I got out and practiced, and oh my goodness, you know, I felt really rusty and I hadn't practiced as many of these skills. And then the nursing said that they really would have liked to have had a little bit more counseling skills in terms of working with patients and in families, and didn't feel as confident in some of those skills, particularly around conflict situations or serious illness where maybe the families were quite upset and the individuals were upset, and they felt that they would benefit from having more of that kind of counseling skills. They all felt that they wanted clinical placements with other disciplines or interdisciplinary team members, because they felt like they didn't have a whole lot of experience in their program, yet they all went out and they're working on these interdisciplinary teams with people that they really don't know their scope of practice, and it's kind of intimidating to sort out who does what, where, and who to call when. And so they felt that they could benefit from that. Both groups felt that they wanted more information of how to work with families and more education on how to deal with microaggressions. Basically, every participant talked about either witnessing racism or experiencing racism, and they found that very different from their educational environment. And it's sort of like, I don't even know how to manage this, you know. So certainly training on microaggressions and bystander and standing up and allyship should be part of our programs. So next slide. So recommendations for employers was they felt that they wanted more management contact and feedback on performance, whether this comes from the manager or the educator, sort of checking in, how are you doing, and giving them some feedback. Because basically the majority of them felt that it was non-existent. So they were kind of floating out there, not sure how they were doing. They wanted welcoming and supportive staff members who offered reassurance and validation and sharing the tips and tricks. Like, you know, they wanted to benefit from the experience of others. They wanted a safe person to talk to without judgment. So who would that be? For some people, they talked about it was a family member that they could phone. But for them during COVID, you know, people that they would normally contact, it was much more challenging to do that. They want to be respected as new employees and treated well. And they didn't always feel that. They would like to have an actual assigned mentor, but that person wants to be a mentor. So several of them talked about this idea of feeling like that they were a burden. We don't have time for you. We don't have time for questions. You can't question everything. So they would have liked a mentor or somebody that really was invested in wanting to help them develop and grow. Orientation on hiring, and again, this was probably impacted by COVID, but many of them didn't really have a thorough orientation. Some people didn't get keys until several months down the road, didn't get a locker, knowing what their rights are. So many of them in the beginning ended up doing horrible amounts of overtime because they didn't feel like they could say no, because you know, they're new, and so, you know, some of them working, you know, 10 and 12 shifts in a row and then being totally exhausted and sort of, you know, can I say no to a shift? The respectful workplace policy, so those that are experiencing, you know, inappropriate touching or racist behavior, who can they approach if they're having difficulty, and how can they be supported? Having a set schedule or EFT. So a number of our graduates were hired into float positions. And they really liked the float positions because they had exposure to different units and different things. But they felt that that delayed their transition to practice because there was no home and there was no welcome and there was no set routine and they never knew when they were working. So they felt having a set schedule or EFT would be helpful. And then more experience working with interdisciplinary staff members, you know, who's who, what do they do, how do you contact them, you know, those sorts of things. And in particular, I think several of the graduates talked about, you know, being intimidated in particular by physicians, you know, and having anxiety if you're having to call for orders or if you're having to call them to look at something that you think is not right, and being new and often being told, like, you know, do I really have to come to the unit, and are you perceiving things correctly? And it would be really difficult for them to say yes, you need to come, because you know the patient's situation is not stable. So
Well,
I think
thank you very much, Deborah, for taking us through our conceptual model of the 12 months and the recommendations we brought forward. I just want to recognize that this project was funded through a Brandon University research grant. And if anyone in the audience or viewing this recording wants to get in touch with one of us, our contact information is on the screen. And I'd like to take a moment to thank the graduates who participated in this research, shared their perspectives with us, and we truly worked alongside them during their first year of transition. So now we'll have the opportunity to take questions, your comments, and discussion. And we will now, at this point, pause the recording and